Hello everyone, I am Will Jackson. My topic deals with the limited amount of research and usage of parents with personal health records or patient portals for their children in healthcare. I have considered both the personal health record or the patient portal interchangeably because regardless of the source, it is the parent that is accessing the healthcare system on behalf of his or her child or children via the internet computer. Having had the experience of working as a pediatric nurse for nearly 16 years, the role of the parent as a historian is key to comprehensive pediatric nursing and healthcare. My topic is specifically centered on minorities with an inclusion of the general public, as well to identify where research and resources should be directed to yield the most favorable outcomes in the pediatric population. In the Spanish-speaking population, it was noted in the personal health records that having the instructions in Spanish would be very helpful, and not in English only, to secure clear communication. Furthermore, in another study that utilized the patient portal, there was a decrease in the likeliness of adults, guardians of children of Hispanics, Asians, and other when compared to non-Hispanics and whites, because the patient portal was in English only. So employing the language in which a parent best understands promotes and promulgates accuracy and clarity in the history taking for the pediatric patient. Not only is lucidity enhanced, but it decreases the duplication of services and healthcare resources. It was noted in the Latino population in Manhattan, New York, that there was a duplication of services when mothers obtained vaccines for their children under 3 years of age from different healthcare providers. This has the implication of excess use of public health resources. As the above-mentioned barrier of language is important in the safe and reliable history-taking in the pediatric population, it is important to note circumstances where parental usage of the patient portal is effective. In the study that focused on the efficacy of the patient portal, results displayed that parents who lived farther away from a pediatric provider and who made more frequent visits to a healthcare provider accessed the computer internet more in the care of their child. This inference in the usage of information technology is paramount to know what works and what does not work in garnishing good and clear communication between parents and pediatric healthcare providers. As examples of a language barrier and computer access for families living far from their children's healthcare provider illustrates the negative and the positive effects, respectively, it identifies a few places in which information technology can be manipulated for safe and quality interaction between healthcare practitioners and families when caring for the vulnerable pediatric population.